Welcome, listeners. This is Ivan Franklin Rose, and this is the one about understanding ADD and ADHD, what it means, and possible treatment options. You may have it or not realize it, or be a parent wondering if your children are suffering from it. I hope this helps. Let's look at what it is and how it presents. Attention Deficit Hyperactivity Disorder, ADHD, or sometimes referred to as ADD, Attention Deficit Disorder, is a neurodevelopmental disorder that can affect children and adults. Individuals with ADHD may present with hyperactivity, difficulty with attention and focus, impulsive behavior, and more. The severity of symptoms can vary, where some may experience little effects and find themselves in social or work environments where those effects do not cause much of a disruption. However, others may be more highly affected and be in a social or educational environment where those effects make even the minimal level of functioning very difficult. ADHD-related behaviors can cause challenges at school or work and often interfere with relationships and social development. Adults suffering symptoms may face challenges, both personal and professional. They may experience memory problems, anxiety, or depression, all of which might lead them to suffering from low self-esteem due to a long history of difficulty meeting goals. Although girls also have ADHD, boys are 3 times more likely to be diagnosed because they are more likely to exhibit hyperactivity symptoms. A 2016 National Parents Survey found that 64% of children with ADD or ADHD had at least one other mental, emotional, or behavioral disorder. Let's look at another such study in depth by the CDC, a mental health surveillance among children in the U.S. from 2013 to 2019, last revisited by the CDC on February 25, 2022. Note, I am including this report for any parents listening who may still have children 17 and under and may find this helpful. Summary. Mental health encompasses a range of mental, emotional, social, and behavioral functioning and occurs along a continuum from good to poor. Previous research has documented that mental health among children and adolescents is associated with immediate and long-term physical health and chronic disease, health risk behaviors, social relationships, education, and employment. Public health surveillance of children's mental health can be used to monitor trends in prevalence across populations, increase knowledge about demographic and geographic differences, and support decision-making about prevention and intervention. Numerous federal data systems collect data on various indicators of children's mental health, particularly mental disorders. The 2013 to 2019 data from these data systems show that mental disorders begin in early childhood and affect children with a range of socio-demographic characteristics. During this period, the most prevalent disorders diagnosed among U.S. children and adolescents aged 3 to 17 years were attention deficit hyperactivity disorder and anxiety, each affecting approximately 1 in 11, 9.4 to 9.8% of all children. Among children and adolescents aged 12 to 17 years, 1/5, 20.9%, had experienced a major depressive episode. Among high school students in 2019, 36.7% reported persistently feeling sad or hopeless in the past year, and 18.8% had seriously considered attempting suicide. Approximately 7 in 100,000 persons aged 10 to 19 years died by suicide in 2018 and 19. Among children and adolescents aged 3 to 17 years, 9.6% to 10.1% have received mental health services, and 7.8% of all children and adolescents aged 3 to 17 years had taken medication for mental health problems during the past year, based on the parent report. Approximately 1 in 4 children of adolescents aged 12 to 17 years reported having received mental health services during the past year. In federal data systems, data on positive indicators of mental health, example resilience, are limited. Although no comprehensive surveillance system for children's mental health exists and no single indicator can be used to define the mental health of children or to identify the overall number of children with mental disorders, the data contained in this full report shows that mental disorders among children continue to be a substantial public health concern. These findings can be used by public health professionals, healthcare providers, state health officials, policymakers, and educators to understand the prevalence of specific mental disorders and other indicators of mental health and the challenges related to this mental health surveillance. Mental health is a broad label that encompasses a range of mental, emotional, social, and behavioral functioning. Mental health, like physical health, occurs along a continuum from good to poor and varies over time in different conditions and at different ages. Good mental health in children includes indicators such as timely achievement of developmental milestones, healthy social and emotional development, and effective regulatory and coping skills. Mentally healthy children function well in various settings, including the home, school, and community. Poor mental health and patterns of symptoms that are severe or persistent and cause impairment or dysfunction can develop into mental disorders. They are defined by the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, as clinically significant cognitive, emotional, regulation, or behavior disturbances that reflect dysfunction in psychological, biological, or developmental mental function processes. Mental disorders are typically conceptualized as categorical, i.e., above or below a clinical cutoff of symptom or impairment scales. And children receive a diagnosis of a disorder when they have specific symptoms that meet specific criteria. Common mental disorders in children include anxiety, depression, attention deficit hyperactivity disorder, ADHD, and behavioral disorders. Good mental health is not simply the absence of a mental disorder. Persons with diagnosed mental disorders can still have a good mental health, e.g., if receiving adequate treatment and support. Throughout life, mental health and mental disorders are associated with immediate and long-term measures of physical health and chronic disease, and with social determinants of health such as racial and ethnic minority status and any associated racial bias, social relationships, presence or absence of crime, and factors that determine access to resources such as education level, income level, and employment status. These and other social determinants of health that affect the environments in which children develop contribute to wide health disparities. Because of the direct connection between mental and physical health, promoting mental health, particularly in the context of social determinants of health, is essential to promoting health equity. Research has documented that policies and programs provided during childhood that improve children's mental health also improve longer-term health and functioning, and also might prevent children from developing a diagnosable disorder. Thus, promoting good mental health and addressing mental disorders among children are critical public health issues. Now let's get back to the earlier discussion written by the Mental Health Center of America. We are going to cover symptoms, causes, consequences of not treating, the 7 types of ADD, ADHD, and ADD, ADHD treatment. First, we'll talk about symptoms. ADD and ADHD can have various symptoms depending on individual and the type of ADD, ADHD they have. The symptoms may also overlap with other mental health conditions such as anxiety, autism spectrum disorder, bipolar disorder, and an oppositional defiant disorder. It's crucial to discover the underlying cause of the symptoms, since treatment for each of these conditions is different. Symptoms can include distractibility. Individuals with ADD, ADHD tend to be more aware of their environment than others. This awareness makes them easily distracted by outside stimuli and causes them to become more easily distracted from a task. Poor impulse control. An individual might speak before thinking, leading to inappropriateness or misunderstanding. Short attention span for routine tasks. The need for stimulation or added excitement to stay engaged with monotonous tasks such as chores or homework. Procrastination. Tasks or projects get done at last minute or even after they're due. Doing well in school or at work can be difficult. Difficulty staying committed to plans or goals. Many people with ADD, ADHD have issues with doing what they're committed to. so they struggle with impulse control and sticking to a plan. Disorganization. Most individuals that have it struggle with time management and organizing their physical spaces. They tend to arrive late, turn in work late, and struggle with the organization of time and space. Let's talk about causes. Some potential genetic causes and unavoidable risk factors can cause ADD, ADHD. A child with a parent who has it is 35% more likely to have this condition as well. Other possible causes include birth trauma, maternal smoking, maternal alcohol or drug use, low birth weight, brain infections, jaundice, or head injury. While these risk factors can play a role in an individual developing ADD or ADHD, there is also the possibility of an increase in diagnosis because of many unhealthy influences in today's modern world that can negatively affect brain function. For example, a diet filled with primarily processed food, preservatives, and artificial dyes. Spending too much time on screen and playing video games. Exposure to too many environmental toxins. So what are the consequences of not treating? If not adequately treated, symptoms can persist through the individual's life. According to the National Institute of Mental Health, 4.4% of adults have ADD, ADHD. While most of the symptoms emerge during childhood, they can continue to affect someone well into adulthood. The conditions can often be overlooked in females because they are less likely to exhibit disruptive hyperactivity behavior than males with ADHD. Untreated, it can result in a higher likelihood of depression, suicidal thoughts and self-harm, substance abuse and misuse, incarceration, divorce and other relationship issues, unemployment and work problems, motor vehicle accidents, obesity, and overall poor physical mental health, dropping out of school, or poor financial decisions. Let's look at the 7 types. ADD or ADHD is not a one-size-fits-all diagnosis. There are several types with some similarities, each requiring a different treatment. There are typically positive results seen when following a treatment plan, regardless of which type an individual has. Dr. Daniel G. Amen is a well-known psychiatrist who's been studying ADD and ADHD for more than 2 decades. His newer research findings include the discovery of 7 types of it, although some similar symptoms appear in each one. With this information, it can be very helpful if you consult a mental health professional for an official diagnosis and subsequent treatment plan that will be most effective for the individual. According to Dr. Amen, the 7 types are as follows. Type 1, classic. General symptoms are inattentive, distractible, disorganized, hyperactive, restless, and impulsive. Type 2, inattentive ADD. General symptoms of individuals with this type are inattentive, easily distracted, disorganized, and often described as space cadets, daydreamers, and couch potatoes. And lastly, not considered hyperactive. Type 3, overfocused ADD. General symptoms of individuals with overfocused ADD are inattentive, having trouble shifting attention, frequently get stuck in loops of negative thoughts or behavior, obsessives, worry excessively, inflexible, have frequent oppositional and argumentative behavior, may or may not be hyperactive. Type 4, temporal lobe ADD. General symptoms of individuals with temporal lobe ADD are inattentive, easily distracted, disorganized, irritable, have a short fuse, struggle with dark thoughts and mood instability, potential to struggle with learning disabilities, and may or may not be hyperactive. Type 5 with limbic ADD. General symptoms of these individuals are inattentive, easily distracted, disorganized, have chronic low-grade sadness or negativity, low energy, tend to be more isolated socially, have frequent feelings of hopelessness and worthlessness, and may or may not be hyperactive. Type 6, ring of fire ADD. General symptoms of this type include inattentive, easily distracted, irritable, overly sensitive, cyclic moodiness, oppositional, may or not be hyperactive. And lastly, type 7, anxious ADD. General symptoms here include inattentive, easily distracted, disorganized, anxious, tense, nervous, predicts the worst, social anxiety, gets anxious with timed tests, often has physical stress symptoms such as headaches and gastrointestinal symptoms, may or may not be hyperactive. So you can see here that in his findings, a lot of the common ones were common throughout. That especially with the top 3, all types had that. And then, depending on the type, the additional things kick in that you can tell the difference between the types. So let's look at treatment. While there is no cure for ADD, ADHD, various treatments are available to help manage symptoms and improve one's ability to function in daily life. Treatment typically involves medications, behavioral therapy, holistic methods such as diet and exercise, or a combination of several treatments. The treatment chosen depends on the individual symptoms and needs. In podcasts, episode 51 on brain fixer-uppers and 55 neurotransmitters, I list natural herbs that have double-blind studies showing help with focus, concentration, memory, and puzzle solving as well. If this should be of interest to you, you can go back to those episodes on Apple, Spotify, or YouTube, or any streaming network for free. Medication treatment. Medications such as psychostimulants like Adderall or antidepressants or non-stimulant drugs can help to treat symptoms. These medications can assist an individual with an inattentive type to stay more easily focused on a task. As with any medication, there are common side effects such as dizziness, loss of appetite, upset stomach, and more. Be sure to talk to your doctor if you notice any unusual symptoms. Behavioral therapy for treatment. While medication can work at a neurological level to help regulate the brain, behavioral therapy addresses specific problem behaviors. It typically involves structuring time, establishing predictable routines and expectations, and rewarding progress. A trained therapist can work with you through behavioral therapy to help adjust your behavior and successfully manage symptoms. Therapists will normally use evidence-based treatment options to help you or your loved ones feel better and create a plan to improve your symptoms. Options include psychodynamic therapy, cognitive behavioral therapy, relational therapy, EMDR, dialectical behavior therapy, trauma-focused therapy, mindfulness-based interventions, and neurofeedback. That last one is very interesting. What is neurofeedback therapy? Also called biofeedback, neurofeedback is the therapeutic intervention and technology that can help your brainwaves work together in a more balanced way. It is a non-invasive training process that helps to create long-term brain function improvement, all without the side effects that are common with drug-based treatments. Neurofeedback helps patients to improve their neuroregulation and stability and modify brain patterns as may have implications for mental health disorders such as anxiety, depression, PTSD, ADD or ADHD, insomnia, traumatic brain injury, stress-related disorders, and more. Both biofeedback and neurofeedback therapies are non-invasive methods that have little or no side effects. What happens during a neurofeedback session? During a therapy session, sensors are placed on your scalp, typically the forehead. You will feel little to no discomfort during the session. These sensors measure electrical activity in the brain and generate the electroencephalograph or EEG. Your brain will then interact with the computer and software based on your brainwave activity. Those signals are sent back to the brain, which causes a change in your dominant brainwaves. This disrupts the brain that is stuck in certain ways of functioning and allows the brain to reorganize in more optimal ways. Similar to rebooting your frozen computer, neurofeedback can help you get out of unhealthy brain patterns. How does neurofeedback, EEG biofeedback, work? I think you may find this whole process fascinating if you listen. It utilizes low-level EEG electrode placements to supply frequencies to the brain. This therapy specifically targets the pre-existing alpha, beta, alpha theta, delta gamma, and theta brainwaves. The goal of neurofeedback is to decrease negative brain patterns and function while increasing positive brain patterns and functions. It measures the individual brain waves followed by the neurofeedback signal. Low energy neurofeedback, such as what is administered at both the Phoenix and Mesa-based Mental Health Centers of America locations, for anybody out that way, delivers a low-level electromagnetic signal to modify the patient's individual brainwaves while they are completely motionless. This passive form of neurofeedback does not require manipulation or stimulation, visual, auditory, or physical, but allows the patient to participate in neurofeedback treatment completely voluntary. Measuring brainwaves and brain functions. Here's what really gets interesting. There are different patterns of electrical activity, also described as brainwaves, that are all recognized and categorized by their individual amplitudes and frequencies. It is the measurement of the frequency that indicates how fast the brainwaves are oscillating. The data is measured by the total number of waves per second, where the amplitude represents the power of those waves. The neurofeedback sensors, electrodes, systematically measure and record these brainwaves and provide feedback to promote neurological improvement. Delta waves are slower brainwaves that occur when the brain is under aroused or functioning at a reduced capacity for mental efficiency. Delta waves are most common when you're sleeping or daydreaming. Beta waves are faster brainwaves and are created when you're more fully awake or aroused. Your brain creates beta waves when you're alert and focused. This causes the neuron network in your brain to be totally engaged to process the information you're interacting with. The faster brainwaves, beta, need to be dominant for controlling attention, behavior, emotions, and learning. If you are producing too much of the slow brainwaves, delta or theta, or too few of the fast brainwaves, beta, then your brain will be operating at reduced capacity. Neurofeedback training and treatment is simply brainwave biofeedback. With this training, you can learn to improve and strengthen your brainwave patterns. The goal is to operate more with the dominant, faster brainwaves essential for focus, organization, follow-through, and basic learning functions. Other issues neurofeedback therapy can help with are worry, autism-related symptoms, anxiety or overfocus, grief, sadness, headaches, obsessive thoughts, compulsive thoughts, anger, irritability, head injuries, concussions, fibromyalgia, chronic fatigue, insomnia, improved performance, improved focus, improved clarity, improved efficiency, and improved concentration. Patients who participate in neurofeedback often notice effects during or immediately after a brain training treatment session. Initial improvements often last a few hours to a few days as the brain is adjusting and seeking a new normal. With additional sessions, the improvements last long and will finally endure. Patients can expect to experience improvements such as a greater sense of calm and clarity, more energy and sense of optimism, a sense of wellness, and a greater peace. You might also try wellness therapeutics. Therapeutic wellness services designed to treat the mind and body include cutting-edge infrared therapy, cold water therapy, red light therapy, hydrogen therapy, and hyperbaric oxygen therapy. And lastly, diet and physical exercise for treatment. Nutrition and lifestyle changes can be an excellent supplement to medication and behavioral therapy in treating ADD or ADHD symptoms. Many individuals find that regular physical exercise can improve focus and emotional regulation. A nutritional diet with fewer artificial ingredients, added sugars, salt, and fried foods can also help to manage behaviors and improve focus. Maintaining adequate nutrition through healthy foods and eating regular meals can be a valuable tool in managing symptoms. Also, keep in mind that this has to do with the gut-brain connection as well. What you eat and what goes on in your stomach and your intestines affects your mind and your thinking, and it's something you could look into. Just Google gut-brain connection. A footnote here. In an article in the Very Well Mind by Keith Lowe, M.A., a therapist and clinical scientist with the Carolina Institute for Developmental Disabilities at the University of North Carolina, specializing in the treatment of ADHD, published on May 31, 2023, and medically reviewed by Claire Eggleston, LMFT associate and neurodivergent therapist, she says, "You may have heard the terms ADD and ADHD used interchangeably. Attention Deficit Disorder, ADD, and Attention Deficit Hyperactivity Disorder, ADHD, are indeed the same condition. It is just that ADHD has had several name changes in the last 3 decades. This is because, as more research is carried out, understanding grows and the name has been changed to reflect the knowledge. ADHD is now the official name. However, many still use the term ADD, the formal name from 1980 and 1987. Some people feel frustrated when they hear ADD and ADHD are the same. They feel that the H, which stands for hyperactivity, doesn't accurately describe them or their child. The Diagnostic and Statistical Manual of Mental Disorders, DSM, is published by the American Psychiatric Association. It's the standard guidelines that doctors, mental health professionals, and clinicians use when they are assessing and diagnosing ADHD and other mental health issues. Each new update and revision of the DSM is eagerly anticipated, as it can mean big or small change in which each condition is called, and in the criteria for diagnosing them, including ADHD, DSM-5 takes into the account the characteristics present in both children and adults. This is good news, as it was felt that adult ADHD was being overlooked in previous DSMs. You can still use the term ADD and people will most certainly understand you. Many doctors, clinicians, and writers use ADD to mean inattentiveness and use ADHD to describe someone with hyperactivity. Some people use ADD and ADHD interchangeably. However, if you can make the mental switch from ADD to ADHD as the term you use, it will help avoid potential confusion and keep you up to date with the most current terms. In addition to the many name changes over the years, our understanding of what it means to have ADHD characteristics has also shifted as research has shed more light on different forms of neurodivergence. ADHD is a disability, but this is primarily because society is neurotypically centered. It is not an abnormality. Instead, it represents a form of neurodivergence, which means differences in how a person's brain functions. Neurodivergent people may behave, learn, and process information differently from what is regarded as typical. While it can be helpful to understand how ADHD characteristics can influence a person's ability to function in their environment, it is important to remember that it is a generic neurotype and not a disorder that needs to be cured. Different approaches can help a person manage their ADHD traits, but each person is unique, and there is no single strategy that works for everyone. Claire also reviewed an article by Amy Marshall, PsyD, updated on October 25, 2025, just recently, recommending the Conners-4 ADHD assessment test for parents or teachers who want to know how a child or adolescent presents in the home and in the classroom. When scored, the Conners-4 will measure attention issues, impulsivity, executive dysfunction, hyperactivity, anxiety, and depression. Scores demonstrate how significantly symptoms impact the child's functioning at school, with family, and with peers. Since it is not unusual for children and teens to have some difficulty with things like focusing throughout the day, arguing with authority figures, or occasionally forgetting assignments, these scales help providers determine when a child's difficulties go beyond what is developmentally appropriate. In addition to these scales, the Conners-4 measures how closely the client's presentation matches the diagnostic criteria for ADHD, oppositional defiant disorder, ODD, and conduct disorder. The Conners-4 ADHD index then indicates how likely it is that a client has ADHD based on these scores. This helps the evaluator determine whether a diagnostic of ADHD can explain symptoms the client is experiencing or if another diagnostic is a better fit. This test is the latest. There are 4 Connors. There's Connors 1, 2, 3, and 4, and 4 is the latest. This is the most up-to-date test that can be implemented. Ask your teacher about it. If you ask your health professional about it, this is one way that has been proven reliable to test for what your child may have, if indeed there is something going on that you don't understand. This has been a fascinating episode to research. My hope is that you, the listener, have gained a better understanding of ADHD and what possible treatments might help. We have given you insight as to how children might be affected by it and what tests to ask for if you suspect your child might present for it. As always, wake up each morning with a smile and be thankful for something or someone good in your life. You can always find something to feel good about. And then you start your day with a positive attitude. This is the way to make sure you have your best possible foot forward and you present yourself in the best manner to those around you. And people will respond to that. Depending what line of work you're in, this could be very important. Possibilities are endless when you take a positive turn and treat life as if it's the most precious thing. And be thankful every day that you're alive and well and have loved ones and are doing something you love. Hopefully, your work is something you do love, and you can always find something else to do in your private time, your private lives, to fulfill that need to have something that you love that you're doing and passionate about. This is my passion, and I love helping people. So until next time, listeners, goodbye.